everybody. Welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thank you so much for joining us for this special edition of that show. We thought we would bring in another expert to talk with you about the coronavirus because there is so much information that continues emerging daily. And some of it, frankly, has changed since we did another special edition of this show just a couple of weeks ago. Our guest today is the Medical Director for Acute Care Services at ZOOM+Care, which is a pioneering healthcare company based here in the Pacific Northwest. He is board certified in emergency medicine and has practiced everywhere from inner city Philadelphia to rural Silverton, Oregon. Joining us live right now is Dr. Mark Zeitzer. Dr. Zeitzer, thanks so much for being with us.
My pleasure. Thank you for having me.
I think the big topic that we've been discussing the last couple of days is social distancing. And I think it's making more sense to people. They're getting a better understanding of what it is exactly. But I think there's still very nuanced things about social distancing that, frankly, I'm curious about. Like when I go, should I be going to the grocery store? I know I've amassed, a couple weeks worth of food and supplies. But should I hold off on going to the grocery store right now? Or if I go to the grocery store, are there things that I should be doing differently?
It's a great question. Thank you for asking. I think that it's really important for us to be very cognizant of what we're doing and when we're doing it. So if you need those chips that you just love and you really want to go to the grocery store, please hold off. Try to get a really good list of things that you absolutely do need, and then go out and try to limit the amount of time that you're going to spend venturing out and exposing yourself and others. And then once you get to the grocery store, try to make sure that there's a minimal number of people in the grocery store. I would recommend taking a cart, but wiping it down. The thing that the cart does is it helps give you that buffer around other people. And then I would try to plan your trip out. Think about your grocery store and how it's laid out. Produce is over here, snacks are over there, milk is back here, and make sure you have a strategy to try to get in and out as quickly as you can. Try not to stand next to other people, and try to move as quickly and efficiently as you can.
Yeah, I noticed even at Costco the other day, there was a big sign right at the entrance as you walked in, encouraging people to maintain that distance from one another. And I think I just saw a report that stores like Safeway are creating special hours for people who are vulnerable, who are, have certain health conditions that diminish their immune systems, allowing them to go in and gather their supplies when there aren't so many people there.
Yeah, that's right. We're seeing where these major chains are letting people in a certain number at a time, and I really applaud those efforts. Those are really important. And then those vulnerable populations, hopefully they have people that can do these types of errands for them or utilize delivery and things like that. But if they have to go, to try to be really cognizant of how many other people are in the grocery store.
Let's talk a little bit about just our neighborhoods. I know that we've definitely seen a lot more families just taking walks in the neighborhood lately. They're walking the dog together. They're out. Fortunately, it's pretty sunny this week, so the idea of being, sheltered in place is less painful when it's sunny out and you can actually get out and get some fresh air. But what is your recommendation on, parks and playgrounds? Should we be staying away from those right now?
Great question. So I think it's really important that we all think about our mental health. This is hard. Social isolation is hard for human beings. We're social animals. I think it's important that we try to get out. I know I have been trying to get out on a daily basis, going for a run, getting some fresh air, and some very smart people that I know say the only people that like this, or the only beings that like this, is the family dog. Because you're right, they're getting out for a walk a lot more than they used to. So I think these things are really important. Going for a hike, being outside is great, but be thoughtful about it. So how many people are you getting in a car with to get to where you're going to do this walk? How close are you getting to other people? And then it's so tempting. We've been so isolated when you see that neighbor that you haven't seen in a while, seen that friend that lives in the neighborhood, to go over and say hi and spend time with them. Try to be respectful and set up time to meet with them over video, wave from far away, send them a text and say, hey, let's set up a phone call, because coming within 6 feet of another person for 15 minutes or longer does put you at greater risk for spreading this. And we do believe that there are a number of asymptomatic carriers, meaning people that don't have symptoms that are carrying this disease, or people who have had minimal symptoms.
Yeah, it's interesting because as recently as a week ago, I think there were ideas floating around that, it was okay to pick one family or just a small group of friends that are responsible, that aren't going out and, wildly exposing themselves in public places, that it would be okay to gather with that small group. I guess, under 10 people is the mandate right now. But you don't think that is actually applicable now?
I think it's really important that we try to minimize this as much as we can. This is really hard for all of us. I'm a very social person. I love having people around. I love having people in my home. And it's difficult. But in order to stop the growth of this virus in the United States, we really all need to do whatever we can to distance ourselves. So setting up virtual conversations is great. I want to use the NBA as an example, right? So we think about one player who was diagnosed with COVID-19, and then very quickly we realized that another one of his teammates had it, and then there's a team in New Jersey, the New Jersey Nets, that 4 players have now it's been announced that the 4 players have had that, and one of those players, Kevin Durant, wasn't even playing. These people are certainly out in the public and they're traveling a lot, so they're at higher risk, but you can use that as sort of a microcosm and think about and see how quickly this can spread. There's only 5 players from each team on the court at any given time. And so one player can spread it to another player because they're within 6 feet of each other for a prolonged period of time. So I think that as more NBA teams get tested, we're going to see that more of those players do have COVID-19. And again, that's just an example of what we could experience socially if we have even a small group of 10 people that we know and trust into our home. They could be meeting with another group of 10 people, and you can quickly see how this can spread.
I think everybody is getting that message now. I want to thank everybody who's joining us live on Facebook right now and submitting questions. That's the whole idea behind this show, is we bring on an excellent expert like yourself, and people from the audience get to ask you that directly. I mediate the questions as we go along. Inez, for example, on Facebook is asking, how long is this virus viable out of an organism? And I'm curious about that too, because I was just reading today about an NIH, National Institutes of Health study that's come out showing that when the virus is carried by droplets that are released when someone coughs or sneezes, it remains viable or still able to infect people in aerosol form for at least 3 hours. And the study also showed that on plastic and stainless steel, the viable virus could be detected after 3 days. On cardboard, the virus was not viable after 24 hours. And on copper, it took 4 hours for the virus to become inactivated. But this information is all still so fresh and limited.
Yeah, I really appreciate how you're using excellent sources like the National Institutes of Health. And we need to take a deep breath and realize that this is important information, but it's also very new information. And in medicine, what we do is we take results and then we try to duplicate them. We try to duplicate them again in different environments to make sure that it's truly the result that is the truth. And then we can base recommendations on that. And we're all very hungry for information around COVID-19. And that information is limited right now because this disease was just identified back in November, was where we think really the first cases started at this point. So we it's a good reminder that it can be present on surfaces and that we need to be so careful. And we need to wash our hands frequently. We need to avoid touching our face like I just did. And we need to keep surfaces clean. And we need to understand that this virus could be viable for a long period of time on those surfaces, and be really careful. But I don't think yet we can say with absolute certainty that that is the truth. And I think things will change as we learn more and as we're able to replicate these studies.
I guess that is the thing about this virus, is there's still so much unknown about it. Like when people say, oh, it's just like the flu, or the flu is worse, that comment has bothered me personally, because it's like, no, we kind of know about the flu. We have vaccines against the flu. And what's like potentially concerning to me about this and much of the medical community is like, we just don't know about this virus. It's foreign to us.
It's absolutely true. It's a good point. But I think that the flu is an interesting model. We think that the flu has a mortality rate of somewhere between 0.1 and 0.4%. And that varies year to year based on how bad the flu is and how well we guessed, and weather patterns. And we just don't know that much about COVID-19. For example, in the United States, testing has been very limited. So we could have a lot of asymptomatic or minimally symptomatic carriers out there. But it is a very similar pattern. The flu is a virus. COVID-19 is a virus, and it spreads very similarly. We think that COVID-19 has a much higher mortality rate, especially for what we consider vulnerable populations. So people over the age of 60, people who have chronic medical conditions like asthma, diabetes, other medical conditions that lower their immune system. And so it is important to think about and look at influenza as a model, and it gives us new perspective about how important it is to get your flu shot. It is also a good reminder that in the wintertime, we need to be respectful of one another. And when we're not feeling well, we should stay home. We should wash our hands frequently, try to cough into our arm. It'll be really interesting to see how this changes our culture. You know, is the handshake dead?
Yeah, absolutely. And in fact, you mentioned the flu vaccine. That was a question that has come in on Facebook. Elizabeth wanted to know, do you recommend getting a flu shot now if someone hasn't already gotten one this season?
Flu shot is absolutely important. It's never too late to get the flu shot. So I would absolutely recommend that you get your flu shot, with the caveat that you need to be healthy, no fever, no symptoms, to get the flu shot. And then right now we're in a place where we're trying to keep as many people out of clinics as possible. So if you have a clinic that takes appointments and can get you in and out quickly for flu shots, that can be a helpful mechanism to go ahead and get a flu shot. The best time to get a flu shot is starting around October, and that will usually give you immunity through March or April. And every year we take a educated guess on a national and international level of what the flu is going to look like, and we try to deliver the best flu shot that we can. Currently, it's a quadrivalent flu shot, and this year it's actually been pretty effective. But we did see a very early flu season. And now we have COVID-19, but we're also seeing some flu A come through the community right now.
Doctor, we have a flood of questions coming in via Facebook, which I would like to get to. There are questions about, is it safe to go to the dentist? Is it safe to be in the car with my kids? You know, is that a safe distance from them? And questions about the actual fatality rate currently for the coronavirus. I want to get to those in just a moment, but I also want to thank the sponsor of this episode, which is ZOOM+Care. As a family, you know, we've used ZOOM+Care plenty. It's so fast and it's easy to get in. You can book appointments online. And right now, I think one of the coolest features they have, it's so timely, is that you can chat instantly with doctors like Dr. Zeitzer 7 days a week. So we've all made the mistake of like going on Google, Dr. Google, and self-diagnosing with what is probably the worst case scenario. I think I've, basically diagnosed my husband before with a brain aneurysm inaccurately. But with the help of ZOOM+Care doctors, you can chat with them and get diagnosis, treatment, even prescriptions issued to you via their chat system. So this is so pertinent right now with the coronavirus, with the medical providers saying, don't just rush off to the hospital, don't prance into the doctor's office if you think that you might have symptoms of coronavirus. So just encourage people to maybe look into that system and make use of it. It makes me wonder, what are the symptoms? I mean, I feel like I keep reading different information about the symptoms to watch out for when it comes to coronavirus. Is it still cough, fever, and shortness of breath?
That is the symptoms that we are getting guidance from the CDC around, and those are really the key symptoms that we're looking for. You're right: cough, shortness of breath, and fever. So ZOOM+Care is also currently offering through chat a way to screen for COVID, and it's going to be around those questions of cough, shortness of breath, and fever. We don't have testing available at this time, but we're doing everything we can to get a testing program for our patients up and running as quickly as we can. But if you have questions around COVID, ZOOMcare.com is a great resource, and we have providers who are happy to chat with you and discuss that with you. And if it's around COVID screening at this time, screening, not testing, we're very happy to help you and to screen.
When you say fever, I want to clarify, because with little kids, I'm always, curious about, okay, is 99 a fever? Is 100 a fever? In the past, I normally don't treat a fever with our littles who are 3 and 5 until they reach like 100, 101, because I've always believed that let a fever, do its job. Obviously, there's different opinions about that. But when you say fever, what is the type of fever that you should put you on alert?
It's a great question, and it's hotly debated, but in the medical literature and in medicine, we're very firm on this. So typically what we say is 100.4 or greater. That's really where we base all the research on, and that's what we say is truly a fever. If your temperature is less than 100.4, then it would be considered an elevated temperature. But for COVID, we're seeing that some elevated temperature down to 100.0 is really where we should start to consider a symptom of COVID-19. So for COVID-19, we can consider 100.0 or greater a fever, and that would be a symptom of COVID-19. And let's also understand that there's millions of viruses out there, and we're all very focused on COVID-19 right now. But that's not the only thing, and it's not the most likely thing that you have. If you have a sore throat, if you have cough or fever, there are millions of other viruses or even bacterial infections that you can have. And in each state, we're seeing tens to hundreds of cases, and think about the millions of people that live in each of those states. So it's really still very unlikely that you actually have COVID.
Interesting. We have a lot of questions coming in about this virus and what happens if you test positive for it. Tamara on Facebook wanted to know if you get it once, can you get it again? Similarly, Eric wanted to know if someone contracts COVID-19 and recovers healthily, are they now immune, and for how long?
These are great questions, and this is unsatisfying, but we just don't know enough yet. This is all very new. We don't know if you can get reinfected, and we're learning more about when a person is truly negative. There are some theories about having people retested within 24 hours of having a negative test to ensure that they are truly negative. And so this is all up in the air, and we're learning more. Questions about, can you still be a carrier even after your symptoms have resolved. So we're looking to the CDC, we're looking to researchers, and hoping to get more and more information about this so that we can provide the best guidance for our citizens, for our patients.
You might have answered this, and the answer might again be I don't know. But Heidi on Facebook wanted to know, how long are you contagious?
It's a really good question, and we don't know for sure. There's also concern about how long you're contagious before you even have symptoms. So that's one of the things that we believe has helped this spread so quickly is, as most viruses, even before you have symptoms, that's usually when you're most contagious.
Okay. Heather and Caitlin and many others want to know about dental appointments and hair and nail salons. Cancel them?
So I think that it's really important that we take care of ourselves. And dental care is super important. And sometimes a nail appointment makes you feel really good. But at this point, I think for those routine things, those things that were scheduled and don't have an urgency to them, I think what is best for you, for the other customers of that dentist, is to cancel those appointments until we get to a place where we're not doing social distancing and we can get life back to normal. I think it's prudent for us all to try to cancel those non-urgent appointments.
Yeah, that makes sense. I had a dental appointment this week, as did our kids, and I was on the fence. I was like, I don't know what to do. I think we should cancel them. And when I went to go make the call to cancel the appointment, the receptionist at the dentist's office says, well, I'm just writing up the note right now that says we're closing our offices. So I said, okay, well, that decision was actually made for us. My sister-in-law posted a meme that said, we're about 6 weeks away from finding out what everybody's real hair color is, which is a little bit of levity in this situation. Juana on Facebook wants to know, are there super carriers? I'm not sure what she means by that, but maybe you understand that question better than me.
I think she's referring to people that have a tendency to spread this more than others. We don't know yet. We do worry because the trends that we've been seeing, there's exceptions to this, of course, but the trends that we've been seeing are usually people who are over the age of 60 who have multiple medical problems are the ones that are most affected by this. So we worry that how are they getting this? Or are the 20, 30, 40-year-olds or even the children getting this, spreading it to loved ones, and they're doing this because they don't even have symptoms from it, or they have very minimal symptoms from it. And so that's why we're really recommending the social distancing, trying to be very vigilant about it. It's hard, but it's so important because you may be symptomatic, you may be a spreader and not even know it. Your kid may have picked it up at daycare or at school and not know it and have very minimal symptoms.
Yeah, and the recent school closure, which now we've learned is extended through, I think, the end of April, Governor Brown here in Oregon was saying that does not actually apply yet to daycare facilities. So daycare facilities can still remain open. So that scenario that you're discussing is potentially likely. Heather wants to know, when you're mentioning kids, so I wanted to follow up on some of these questions again that are coming in live. Heather wants to know, is it okay for her to be in the car with her kids distance-wise?
Presumably you live with your children. So it's important that when you pick them up from daycare that you try to do everything to make sure that they wash their hands and try to be careful about what surfaces they touch. But absolutely, you got to move your kids around and you're living with them. So thinking about ways that you can keep them clean, maybe even changing clothes when they get home or before they get in the car, and keeping hands nice and clean. It's really difficult. Kids are awesome. We love them, but they are petri dishes. They put their hands everywhere and then they go right in the mouth.
Yeah, absolutely. I've witnessed that myself. Bart, on the topic of children, wants to know the chances of a 1-year-old child getting it. He's seen a lot of adult cases, not a lot of child cases. Does that still remain true? Like, I think I read that there was only, at one point, one death related to coronavirus of someone under the age of 19.
We are seeing the trend that the people that are most affected are those that are 60 and above and have multiple medical problems. There's always exceptions, and we have to be really careful when we look at these numbers and that we don't anchor in on one specific example that is outside the trend, outside the mean. But that is the general trend of what we're seeing. There are definitely people that have gotten sick with this who are outside of those specific risk factors. But overall, we are seeing mostly people who are older with other medical problems.
What are you seeing in terms of our testing capability? I mean, this is really a crisis point right now and a frustration for, I think, a lot of Americans who don't understand why there aren't more test kits available. And what do you see on the horizon for testing?
You're right. This is a very frustrating situation when it comes to testing. And testing would help quite a bit. When you look at a per capita basis, the United States is way down. South Korea has done a much better job of getting testing out there. The FDA is trying to protect our interests by making sure that we have accurate tests, but also can be a barrier to getting those tests out there as quickly as possible. Yesterday, from the state laboratories, there was only 80 tests available. And so they are only testing the sickest of the sick. LabCorp and Quest have tests that are up and running, but there's a backlog. They're not in every state. Samples have to be sent around. ZOOM+Care is working very hard to do everything we can to get testing up and running. We do not offer that at this time, but we hope to very soon. And it is very important because then we would know, are there asymptomatic carriers? Is the mortality rate much lower than what we actually believe it is today because we're only testing the sickest of the sick? So testing is absolutely key, and it is very frustrating.
I wanted to follow up on the fever question. There was a woman on Facebook, Susan, who wanted to know how long will an infected person run with fever? Is it throughout the illness, or is it just the first few days?
Typically, it's just going to be the first few days. And then, typically the guidance is, you probably know this because you have young kids, you're trying to get back to daycare and school, 24 hours without fever, and they can return. In this case, with COVID being all over the community, what we're trying to encourage people to do is to be fever-free or symptom-free for 72 hours or a week, whichever is longer. So a very different guidance. And the fact of the matter is that we're all social distancing ourselves. We're all staying at home, working from home. So things are not really all that different. But if you do have symptoms, fever, cough, shortness of breath, it is really important that you try to quarantine yourself from other family members. Think about the surfaces that you touch a lot, door handles, faucets, and try to use one bathroom, washing your hands frequently, and staying away from other family members to keep from spreading it. And then 3 days, 72 hours symptom-free, or 7 days, whichever is longer from the onset of your symptoms before you can think about getting out of quarantine.
And is that if you only have all three symptoms present, or if you have just a cough, or if you have just a fever?
So cough is very broad, right?
Yeah.
People have coughs for all different types of reasons. People have asthma, COPD. So if you've had a chronic cough, that's probably not it. If you've had a change in your cough, if you're bringing up sputum, that could demonstrate a change in your symptoms, and that may be a symptom of COVID. But we're all quarantined, we're in small places, and even if it's not COVID, you could be spreading that to the people that you're quarantined with or that you're with in the same home. So always a good idea washing your hands, coughing into your elbow, and trying to touch others as little as possible, being conscious about how often we touch our faces.
Okay. There's a lot of talk about vitamin C, zinc supplements. Dell's saying, let's do some myth busting here if necessary. Dell wants to know, does vitamin C with a zinc supplement help maintain your immune system against coronavirus?
I wish it did, but at this point, there's no evidence that it does. Vitamin C is something that we've looked at on many different levels. There's ongoing interest in vitamin C when it comes to sepsis, and that's still up in the air, but that's a very different form of it. That would be an IV form of vitamin C. And unfortunately, when you have too much vitamin C, your body knows what to do with it. And what does it do with it? It pees it right out. So vitamin C, there's no evidence that it helps when it comes to getting better from an infection, viral or bacterial or otherwise faster. And when your body gets too much of it, it just pees it out.
Okay. Beards, this has come up. Margarita on Facebook wants to know about beards on men. Are they safe? Do they need to shave? Long nails or short nails? Which is better, or does it make a difference at all?
These are all great questions. So you've probably all seen on Facebook, the CDC has this great map, if you will, of different facial hair and the different names of it. We all love it. And the reason why that is out there is because there's certain facial hair that's compatible with those N95 masks, and there's certain facial hair that's not. So in general, I would say that facial hair can obstruct a seal on a mask, but many of us aren't using those masks. Those N95 masks look really cool and very protective, but unless they're fitted properly, they really don't do us any good. So we have to be very careful about using those. Regular surgical masks can be up to 85% effective, but we don't want to be using them at all times because it's not necessary. So keeping fingernails short is a great idea because bacteria love to hide under there. It's moist, it's warm. Viruses can also hide there. And I think that beards can be a place where, because it's warm, it's protected, that viruses and bacteria can hide as well.
Interesting. Now this is a curious one. I've never thought about this. There was a woman, Sharon, on Facebook wanted to know, when walking, should we zigzag away from others to keep a 6-foot distance from oncoming walkers? Do you think that germs stay in our wake when we walk along? It sounds like a funny question, but I get what she's asking.
Yeah, I think she is asking a really good question. So in general, the study that you had just quoted from the NIH, we are seeing that when people sneeze and don't protect themselves well, when people cough, that plume can be expelled and can sit in the air for a long time. So I think it's reasonable to cross the street and to move away from others. And I think that we all understand where we're coming from today. So it's not rude anymore. And it's probably not a bad idea. I don't want to set any panic out there. We're really looking at 15 minutes within 6 feet of another person of continued exposure. 15 minutes, 6 feet. And so when you're walking by somebody, that's not happening.
Got it. All right. Doctor, thank you so much for being with us today. I invite you to maybe go onto the Facebook page for this particular episode and take a look at some of the additional questions that people have submitted. There are questions about asthma, whether people who have asthma are more at risk. I think the answer to that is yes.
It is, yeah.
Yeah, because this is a pulmonary respiratory type issue. And I guess I just want to close with your advice for people in terms of their mental health, which I think ZOOM+Care is also equipped to assist in. I mean, there's a lot of anxiety. There's anxiety among adults. I think it's probably transferring to our kids as they hear us talk about this. What would be your thoughts on mental health as we're all isolating from one another and not going about our normal social lives?
Yeah, that is so important. I saw a number of patients just recently that were coming in with concerns about cough and shortness of breath. And really, they didn't need to be in the clinic. They had a lot of anxiety. And ZOOM+Care does have a really robust and wonderful group of mental health providers. We're all dealing with a lot of anxiety. So I think the biggest things are to find the things that bring you joy in life at this difficult time, spending time with your family, playing games, distractions, getting outside, getting exercise. And we, as ZOOM+Care, are more than happy to help also if there are medications or therapies that you need to take off the edge of that anxiety, or if there's depression that you're experiencing as well, which is very normal in this very difficult, unprecedented time. We are there for you.
Oh, not only that, I mean, before you go, I just had one last thought. I remember there was one more question I really wanted to get to, but, on top of all of this, people are getting laid off from their jobs. I mean, it's not just the health concerns, it's the financial concerns. How are people going to pay their mortgages? How are people going to pay their rents if they're losing their jobs because hotels and restaurants are shuttering down? I have so much empathy right now for us as a society with everything that's happening. You mentioned the things that bring you joy, getting out in the outdoors. There was somebody on Facebook who wanted to know, is it safe to go hiking with friends, assuming that the group you gather with maintains that 6-foot distance and you're in a big, wide open space? We're here in the Northwest. We love the outdoors. What are your thoughts on activities like hiking or even like golfing?
Yeah, those are great questions. I think it's really important to put it into context and remember that we got to get there, right? And so if we're getting 5, 6 people in a car together, that's not a great idea. Probably best to take separate cars. Make sure that we're still washing our hands frequently, even if we're outside, because when we're exposed to the elements, we tend to put our hands on our face even more often. And I think it is a good idea to get outside, but to think about how we get there and who we're exposing ourselves to and what else we can do to keep that social distance.
Interesting. All right. Thanks so much for your sage advice, and I appreciate your time today.
Thank you. It's been a pleasure. Appreciate the opportunity.
And thank you for joining me for this special edition of That Expert Show. I truly hope that we were able to answer many of your questions. As you heard, I've asked Dr. Zeitzer to maybe take a look at the questions that we weren't able to get to. But please drop me a line on social media. I'm on Facebook, Instagram, and Twitter at Anna Canzano. Let me know if there are further questions that you would like answers to. I assume we'll be doing more episodes with more experts on this topic because it is just so timely, and I want to keep bringing you the most updated information. You can check out previous episodes of That Expert Show on our website, thatexpertshow.com. We create a tip sheet for each episode that we do. We will create it for this episode, so it summarizes the key points that we covered. We also post that on our website. You can watch us on YouTube. You can also listen to us and subscribe to our podcasts on Apple iTunes, Google Play, Stitcher, TuneIn, Spotify, all those good places. Really appreciate you joining the conversation here. It really is the whole idea behind this show. I find the experts, I give you access to them, and we all learn together to try and be healthy and smart and hopefully find, the light at the end of the tunnel in this whole situation. So it is called That Expert Show, where you help run the show.